The Georgia State Office of Rural Health, a division of the Georgia Department of Community Health, exists to improve access to health care in rural and underserved areas and to reduce health status disparities. The SORH office is one of only a few state agency offices that is not located in Atlanta. Appropriately, the Georgia General Assembly chose to place this office in the small rural community of Cordell, Georgia, allowing all SORH staff to be personally connected to the citizens they serve on a daily basis. Stephen Register, who has served as the executive director of the SORH office since early 2020, coined the tagline, "Leading the Fight Against Rural Health Disparities," to summarize the overall mission of the Georgia SORH office. Here, Stephen explains in his own words the health disparities that affect everyday citizens of rural Georgia.
I think if you're thinking about Georgia health disparities, you really have to look at Georgia. Georgia has 159 counties, of which 120 of those are rural counties. And to put it another way, nearly 2 million Georgians live in a rural county or either call a rural county their home. So if we're thinking about health disparities are really differences in health status when compared to the overall population. There's many things that the State Office of Rural Health does. I think it's best summarized in or through our 4 program sections that we operate and funding through to specific grantees, and so we manage and administer many grants within those program sections. In fiscal year 2022, the State Office of Rural Health was responsible for managing over $40 million of state and federal funding, which really met the Department of Community Health's mission of providing rural Georgians access to affordable, quality health care. So that's our true mission, and the State Office of Rural Health really takes that task to heart, and we enjoy serving our rural residents.
Even in his relatively short time at the SORH office, Stephen says he has been pleased to see the office continually grow in the scope of its work, and he looks forward to all the great opportunities coming in the near future for the Georgia SORH.
One of the things that we're most excited about is the future and what the future holds. I think, as we've seen in the last 2 years as a result of the pandemic, rural health has been highly recognized as an area that needs more focus, and we welcome that. We want there to be more recognition on rural, because what it's done is it's provided great opportunity with regard to more innovative projects being created to attack those disparities that have plagued our communities for so long, and really from all angles. And what I mean by that is that I've been very encouraged to see the synergy within all rural health spaces that's occurred due to the overall objective of providing health services in a more collaborative approach, whether that's access through telehealth or clinics and hospitals talking with one another, or simply just improving transportation deficits within these rural areas. Rural health innovators, quite frankly, our heroes, are partnering together to tackle these rural health problems together. And that's what's been so fantastic to see, is that there's a ton of communication going on, over communication going on, and there seems to be that solidarity within the healthcare community. And our work really in this fight is to lead and connect these partners together. In doing that, what we're hoping to find is that with connecting those together, that you'll see more increased outcomes that result in a better and more accessible health care for our rural communities.
For more information on the State Office of Rural Health, please visit us on the web at dch.georgia.gov.